Ask the Expert, sponsored by St. Elizabeth Healthcare.
Well, there's new information today that could help women diagnosed with breast cancer.
Medical reporter Liz Bonus joins us now with research on the emotional impacts of treatment. Liz.
Hey guys, good evening once again. This new study, one of the largest ever done of its kind, it could make a big difference in what type of treatment women choose when keeping at least one breast is considered a good option. It's one of the first to look at things such as stress and worry that often follow surgery. And women's health specialists at St. Elizabeth Healthcare say it brings up a really important discussion to have before this surgery.
Hi, Jen. How are you?
Janice Godby admits that even now, a year after her diagnosis of breast cancer,
Still working out. Actually, some of the emotional things were more difficult after all of the fuss was done.
the fuss, you might say, for her is what Dr. Michael Gunther says many women go through: surgery to remove the cancer and reconstruction of the breast. Surprisingly, however, Dr. Gunther says that what most women don't realize is that in most cases,
A lumpectomy and a mastectomy for almost every woman have the same survival and the same recurrence rate.
even so, a study by PCORI, or the Patient-Centered Outcomes Research Institute, recently found many women choose to remove the other healthy breast as an extra precaution, not realizing some of what Janice Godby says she's now experienced living as a survivor with the treatment choices she made.
You've lost parts of your body. That's something you're never going to get back. When I started to look at it that way, I'm still having a hard time owning it.
The study looked at a very important part of those choices, not just what happens physically and whether or not cancer returns, but more importantly, some of the things that go on with your psychological and physiological well-being. The research team compared two groups in this study: patients who had both breasts removed and patients who had part or all of the breast with the cancer removed but kept the healthy breast.
Most of the time, people do have a choice between keeping a breast or removing it.
Dr. Gunther says in those who removed a healthy breast, there was a much higher emotional impact.
There's a lot of physical issues, there's some discomfort that happens, there's a lot of self-image issue, and there's even some sexual issues with spouses and loved ones that are things you wouldn't necessarily understand.
He suggests all women consider this information when making treatment choices.
The numbers are pretty high. It's almost 50% of people have some sort of alteration in their normal sensation and what they like and don't like. It's a real number.
It is life-changing. It is something. There is a new normal now, and you learn to be content with that and even happy.
She's remarkable. It's important to point out that there are specific considerations when there's precancerous cells, genetic mutations, family history that may lead your healthcare provider to suggest you remove both breasts. But if that's not the case, this is really important to think about. The emotional impact may be stronger than even, well, if I just take off the other breast, I'll be fine. We don't always think that far out.
And important to just get help with a decision.
Yes, and remember that we didn't used to think about these because we didn't used to live this long after it.
that's true.
So there's some reward in that as well, that we're finally looking at some long-term results.
And we didn't talk about it.
Absolutely.
We really didn't. So
Yes.
it's good to be out there.
So thank you.
Thanks,
Thank
Liz.
you to the providers that do. Yeah.
Wish them all the best. Thanks.